We are from LAX2049 from Group 44. So today we are going to discuss on the video discussion number 4, health. So as usual, at the end of the session, we will choose the best two of the news that have been shared by our group members to be put in our news. So first of all, let us introduce ourselves. My name is Muhammad Nur Shawar bin Maulan. My metric number is 193387.
Hello, my name is Muhammad Aziz bin Hashim and my metric number is 191964.
Hi, my name is Muhammad Nur Hafisham bin Jailani and my metric number is 192233.
Hello, my name is Alif bin Ismail. My metric number is 192410.
Hello, my name is Muhammad Haji Amzal bin Pisal. My metric number is 191987.
My name is Siti Nasaran bin Muhammad Zaha. My metric number is 204222.
Hi, my name is Siti Nur Fazila binti Ali. My metric number is 202299.
Hello, my name is Rajini and number 1911.
So I think every one of us has introduced ourselves. So let us start with the sharing session. So anybody want to start by sharing their news about health?
Has found an article about mental health, which is depression and anxiety. So this article is written by Kimberly Holland on June 20, 2018. So depression and anxiety have link, which is depression and anxiety can occur at the same time. In fact, it's been estimated that 45% of the people with one mental health condition meet the criteria for two or more disorder. Okay, what is depression? Depression is feeling like feeling down, sad, or upset. It can be concerning feeling that way for several days or weeks. How to know that we have depression? Actually, it can shown by some symptom, physical symptom and emotional symptoms. So I want to focus about the emotional symptoms. So the symptom that we can have is loss of interest, persistent feeling of sadness, feeling hopeless or pessimistic, anger, feeling guilty, and we have the thought of suicide attempts. And next, anxiety. What is anxiety? Anxiety is the feel of fear and worry. It can happen to anyone from time to time. But chronic anxiety can be debilitating and lead to irrational thought. And the symptom also the same. We have two symptoms, which is physical and emotional. So I want to focus about the emotional system also. So we can feel restlessness, difficulties controlling worry or fear, dread, and panic.
I will talk about a health disease or a health problem, which is asthma. Okay, so asthma is a long-term disease of lungs. So asthma cause airways to get inflamed and narrow, and it makes a person hard to breathe. So asthma, so studies shows that 25 million of Americans and cause nearly 2 million emergency room visits every year for asthma patients. So the major symptoms are the airways blockage. Second is inflammation, and third is irritability. Okay, so the symptom causes a person to cough excessively, wheezing. Wheezing is it makes a sound when you sleep. It makes like some sound when asthma person sleep, and asthma cause a person to have problems when they sleep. So it's difficult for asthma person to sleep.
Okay. So today I want to talk about COVID-19 vaccine. So as you know, we have already in MCO, Malaysian Movement Control Order from March of this year, 2020, and we still don't know when this pandemic will over. So as the solution, Malaysia has signed its first COVID-19 vaccine agreement, purchasing 12.8 million doses of the Pfizer BioNTech vaccine. So Pfizer BioNTech is a company from German that invent the vaccine to immunize 20% of the Malaysia population. Our current Prime Minister Muhyiddin Yassin said under the Malaysian government's preliminary purchasing agreement with US Pfizer is US and BioNTech is from Germany. It's an agreement from US and Germany company has agreed to purchase to those regimen will be given to 6.4 million Malaysians starting next year. So for the arrangement, the company has agreed to give 1.7 million doses for the first quarter, 5.8 million in the third quarter, and 4.3 million doses in the fourth quarter. So the amount of the vaccine is about US dollar 249.6 million or one ringgit billion for 12.8 million doses. However, it is unclear how much the Malaysian government is paying for this vaccine.
I will talk more about the symptoms and how to prevent this disease. So first, we need to know what is COVID-19. So basically, COVID-19 is a coronavirus disease, which is an infectious disease caused by a newly discovered coronavirus. So basically, COVID-19 is a short form of coronavirus disease, and as this disease has been infectious during year 2019, so they call it COVID-19. So here are a few symptoms that will tell that the person have been affected with the virus, which is the symptom is divided into three categories, which is the most common, the less common, and the serious symptoms. So the most common symptoms that is fever, dry cough, and also tiredness. And the less common symptom is ache and pain, sore throat, diarrhea, conjunctivitis, headache, and loss of taste or smell, a rash on skin, or discoloration of fingers and toes, and also and the last one is the serious symptoms is difficulty breathing or shortness of breath, chest pain or pressure, and also loss of speech or movement. So So basically, the most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. So older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness.
For this topic of publication, which is health, I want to share to all of you about sleep. Why sleep is essential for our body. Okay, getting enough sleep is essential for helping a person maintain optimal health and well-being. When it comes to their health, sleep is as vital as regular exercise and eating a balanced diet. Okay, based on the article in medicalnewstoday.com, sleep not only give our body and recover our energy, but it also can give many benefits to our life. Okay, for example, I will state 9 benefits of sleeping for our life. Okay, first, sleep can make better productivity and concentration. Second, sleep can lower weight gain risk. Third, better calorie regulation. Fourth, greater athletic performance. Five, lower risk of health disease. More social and emotional intelligence, prevent depression, lower inflammation, and lastly, stronger immune system.
Today I would like to share a story about the benefits of taking breakfast. Firstly, most of Malaysian, I think they do not take breakfast every day or regularly. So that's why I think I want to share about this story. Yeah, one of the benefits of taking breakfast, I think, is what I read is the main source for energy throughout the day. This is because during breakfast we regularly take food that has high content of carbohydrates, which also means it contains a lot of glucose. Glucose is the main source of energy to our body. So why I think this is a benefit, why I think it is good to take breakfast based on this article story. It says that people that take breakfast have more energy to do physical activities than people that do not take breakfast. Okay, next, one of the other benefits is breakfast also can help us to lose or control weight. This is one of the reasons that I think people in Malaysia tend to be overweight or obese because they do not take breakfast. So when we take breakfast, our appetite can help to be controlled throughout the day. So that's why we will have the appetite to eat food, or so that we can control our weight.
I would like to talk about mental health. I want to add something from what that Hafisham had already explained just now. It's not just now, actually, a few minutes ago. Due to this COVID-19 pandemic, there are a lot of people losing jobs, and actually, so it's actually affect to their mental health. So, from WHO, demand for mental health service of countries increasing to 19.3% due to COVID. And a billion people affected by this pandemic, close to 1 billion people living with mental health disorder. And in Malaysia, 424,000 youth and children suffered from mental health problems are among usually in among B40. So this mental health is actually not a simple issue that we can take it easy, because this will lead to suicide, mental problem, and so on. So especially in COVID situation, our country did the best alternative to help our citizens. So for a better access to quality mental health is needed, no matter what financial for everyone, not without caring about the financial status, location, or social status. So about this mental health is actually people need to concern more. Thank you.
Okay, thank you, Fazila. Okay, my topic for today is about the heart attack. Heart attack is happen when blood vessel blocked by plaque, usually the cholesterol. It also can happen because of the torn blood vessel. So we will go to the symptom. The first one is chest pain or discomfort, sweating, dizziness, and fatigue. But there are many more symptoms, and it can differ between men and women. And the factor that some people get this disease is because first, the age. If you are over 65, your risk for having a heart attack is greater. The second one is the gender. Men are more at risk than the women. The third one is about the family history. If you have a family history of heart disease, high blood pressure, obesity, and diabetes, so you are more at risk. And the fourth one is the race. People of African descent have a higher risk. Okay, another risk factors that can change is if you're a smoker, high cholesterol, if you are eating the high cholesterol food, obesity, like exercise, diet and alcohol consumption, and also stress.
We have come to an end, so it's time for us to vote the best two news to be put in our final. So let's start with Hafisham. He tells about what depression. So who agreed to choose Hafisham? Hafisham news to be put. 1, 2, 3. All right. So next, we'll go to Hazi Amza. He's tell about the coronavirus vaccine. Who agree to choose Hazi Amza story news? Right. Next is Razif. He tells about who want to vote Razif news? Anybody? All right. Next is Nur Sarah. He tells. So who want to vote Nur Sarah news? All right. Next is my news. Shawal. I talk about coronavirus. Who want to vote my news? Right, next, Alif. He talks about asthma. Who want to vote about his news? Next is Siti Nur Fazila. he continue. Hafisham, he talk about depression also. Who want to vote about Siti Nurfazila news? And the last one is Muhammad Haziq bin Muhammad Hashim. He talk about the benefits of sleeping. Who want to vote his news to be put in the last? Okay. I think we have got the two best news to be put in our final newspaper, which is my news and also Hafisham news. Congratulations. So I think that's all from us today.